Let's discuss heart patterns, obstruction of the heart vessel. This disease is mostly due to blood stasis, retention of phlegm, cold coagulation, or stagnation of qi, all of which blocks the heart vessel. Clinical manifestation, palpitation, a suffocating feeling and pain in the chest, radiating to the shoulder, back, and the inner aspect of the arm. The pain is sometimes present and sometimes not. In cases with stabbing pain, dark tongue with blue and purple spots, and a thready and choppy pulse, knotted or intermittent pulse, this pertains to blood stasis in the heart vessel. In cases of obesity with excessive phlegm, heaviness of the body, suffocating pain, white greasy coating, and deep and slippery or deep and choppy pulse, this refers to the retention of phlegm in the heart vessel. In cases with sudden attack of severe pain, which can be relieved by warm, cold limbs or a pale tongue with a white coating and a deep and slow or deep and tense pulse, this indicates stagnation of cold or cold coagulation obstructing the heart vessel. In cases with distending pain, ribs side distension, frequent sighing with the attacks of being often related to emotional factors, a pale red tongue with a thin and white tongue coating, and a wiry bowstring pulse. This refers to the qi stagnation of the heart vessel. Analysis, this disease may be derived from other heart patterns, particularly heart-yang deficiency, so the symptoms vary according to the different pathogenic factors. The pathogenesis of this disease is divided into 4 patterns: blood stasis, cold coagulation and retention of phlegm, stagnation of qi, all of which obstruct the heart vessels. Key symptoms: palpitation, a suffocating feeling and pain in the chest, radiating to the shoulder, back, and the inner aspect of the arm, accompanied by symptoms of other heart patterns which can obstruct the heart vessels. This pattern may be simply caused by blood stasis or a pathogenic cold pathogen. However, pathogenic factors mostly exist in combination, such as qi stagnation combines with blood stasis, qi stagnation with phlegm retention, and qi stagnation with blood stasis and phlegm retention. Cold obstruction combines with qi stagnation and blood stasis, etc. Phlegm retention is usually accompanied by blood stasis. Therefore, only when the main symptoms of different patterns are precisely differentiated, then an accurate diagnosis will be made. So here, the analysis of heart vessel obstruction. When there is heart-yang fails to rouse and warm the heart, there is palpitation. The heart qi fails to move the blood and heart vessels are blocked. Suffocating feeling and pain in the chest. Impediment of qi of the heart, channel of the hand, xiao yin. There is pain radiating to the left arm, shoulder, and back. There is static blood blocking the heart vessel. There is stabbing pain with blood stasis. When there is phlegm retention blocking the heart vessel, there is suffocating pain with phlegm retention pattern. When there is cold coagulating blocking the heart vessel, there is sudden severe pain which can be relieved by warmth. When there's static qi blocking the heart vessel, there is distending pain related to the emotions and usually accompanied by qi stagnation symptoms. For the treatment principle, invigorate heart qi and blood, transform phlegm, expel cold, and calm the shen. For the acupuncture points, choose from pericardium 5, pericardium 6, heart 5, REN 14, REN 15, REN 17, UB 14, UB 15, UB 17, spleen 10, stomach 40. Needle technique, spreading technique. Explanation: heart 5, PC 6, REN 14, REN 15, UB 14, UB 15, invigorate heart qi and heart blood. spleen 10 and UB17 invigorate blood. Ren 17 circulate chi and blood in the upper jaw. Pericardium 5 and stomach 40 transform phlegm and move chi in the chest. Relevant advice, light physical activity will be beneficial. However, it is important that the person does not overexert themselves if there is an underlying depression pattern. Beating the chest and upper back with a loose fist or a wooden spoon, or rolling the shoulders and swinging the arms can also be recommended, as well as getting adequate exercise. It is also important that they get sufficient rest and relaxation. They should avoid stress and overexerting themselves physically. They can play sports. It is important that they do not expose themselves to the cold when they sweat. They should avoid foods that create dampness and phlegm. Here, the table of differentiation of various pathological factors in the obstruction of the heart vessel. For the disease, obstruction of the heart vessel, the symptoms, palpitation, a suffocating feeling and pain in the chest, radiating to the shoulder, back, and the inner aspect of the arm, pain comes and goes. For the pattern, blood stasis, the characteristic of symptoms, there is dark tongue with blue and purple spots and a thready and choppy pulse. For the pattern of phlegm retention, the characteristic of symptoms, excessive phlegm, heaviness of the body, suffocating pain, while white greasy coating, a deep and slippery pulse. For the cold obstruction, the symptoms, there is sudden attack of severe pain which can be relieved by warm, cold limbs, pale tongue with a white coating, and a deep and slow or deep and tense pulse. For chi stagnation, the symptoms, there is distending pain which is related to emotional factors, pale red tongue, and a wiry pulse. Thank you for your attention.